Hello, everyone, and welcome back to the Future in Review podcast. I'm Berit Anderson, the COO of Future in Review and Strategic News Service. And I'm here, as usual this week, with Mark Anderson, our CEO, who is also the author of this week's Global Report, all about Watson, IBM, Theranos, and the future of AI and healthcare, and how we are we are in the middle of a new emergence of machine learning and healthcare and its potential for new discoveries. So Mark, thank you for writing about this topic. We've talked a lot about ethical AI and the importance of the black box, solving the black box problem in neural networks in past podcasts. So I think our viewers are probably pretty well versed. Let's assume that they're pretty well versed on that topic for today. And I want to focus more today on the applications of what you were talking about. So you write about Theranos and IBM's Watson as kind of disasters in the field of AI and healthcare. And I'm wondering if you could tell me, in your opinion, what made those companies such disasters?
Sure. And they're in those two pairings, right? AI over here and healthcare over there. Watson was kind of a beautiful disaster, like a perfect storm. There were so many things that were wrong. It's kind of awe-inspiring, really. IBM, of course, had the product. They were selling it as the epitome of AI, I think, to everybody. They focused on healthcare because that's where all the money was. They went on Jeopardy and they beat the Jeopardy team, and that got them a lot of marketing muscle. Everybody thought it was the future of AI. First problem was 3/4 of the Jeopardy questions came from Wikipedia. So all the system had to do was read. And Watson, if nothing else, was probably the best reader in the world. It read, I forget, it's like 10,000 pages a second. It really was good at reading. Not thinking, reading.
Yeah.
So it read, and I would call it parsing. So you kind of knew the structure of a sentence. So if you said, who is George Washington? It would tell you who George Washington was. Great for Jeopardy. Not great for curing cancer. And even today, the saying is that Watson has not saved a single life. I don't know if it's true, probably true. So there was even a deeper problem with being a great reader if you're going to healthcare. Studies have shown us that the top 2 medical journals it was reading do not have reproducible results in their results. So in other words, they're cheating. They're like conference. They're often sponsored by a corporation or some private entity. They throw out data they don't like. They insert data that may not be true. It's pretty fraudulent and cannot be reproduced by other laboratories. Therefore, you wouldn't want to read as a path to curing. It's not a great path. And so they had a double jeopardy in what they were doing. And it was the biggest failure of all time, maybe of all products. It was quite a crater that was created there. If you switch over to the main healthcare world, you say, well, Theranos, that was just fraud. It's not about AI, it's just fraud.
Yeah.
She's going to jail, and who else? But the idea that you could build a fraud, what was it, 9 billion, I think it reached in valuation, and you've got Henry Kissinger and all these generals on the board, and what could possibly go wrong? Except no one on the board knew biology,
right,
or biochemistry, or blood chemistry, which is all the stuff they were doing. So it was a complete gap between the stated charter of the fraudulent enterprise and the people who are supposed to govern it. And you can make up your own reasons why that happened, but it was so obvious if all you do is just look at the board, and it's like you're just seeing all these old guys, and they're from the military. Well, I'm sorry, I like the military, but I wouldn't put them on the board of a biotech company. So it was a complete fail for a good reason. Don't ever do that again.
For a good reason. I'm not sure if it was a good reason.
Oh, bad reason. And don't ever invest in a company like that either. So. Yeah. Anyway, it was, in retrospect, it was quite predictable. You have a dropout who's probably not very well versed in that world, and you have a bunch of people to govern the dropout who didn't have any idea what they're doing. So there's healthcare and AI, like in the last 10 years. These are the biggest events maybe that happen.
And so tell me more about, you're running a biotech company now, essentially a biotech company. It's not a biotech company, it's a computing company.
That's right.
But you're focused on biotech as a field for discoveries.
Yes.
What impact have those two failures had on your ability, how has that affected your ability to do business?
So from the Theranos side first, if you asked any startup in the Valley, not just in healthcare, they would say that just created such a crater that no one's going to, do anything in AI for a long time, or any healthcare thing, or any young startup, or it just created a gigantic crater in terms of investment. People were so gun shy for years. It was like, are you Theranos? Are you Theranos? Are you Theranos? No, there's only one of those.
No one wants to be the next Theranos, and therefore they're afraid of investing in companies that they think might have that.
Yeah. I think now, I don't know, it's 5 or 10 years later, I think we finally gotten over it, but it took a long time. And then same thing with Watson in a different way. Here's IBM. Now, IBM, I think, lost money in increasing revenues going down every quarter for, I don't know, years. But the CEO didn't get fired. I don't know why. And they were pushing Watson the whole time. And so you had big places like MD Anderson, world famous cancer center, buying it. I believe they spent 20 million. They just flushed that money out. They literally just said, threw IBM out of the place. This is a complete waste of time. So the bow wave of that was equally large or worse because IBM was behind it.
So it's almost like you've got, from a funding perspective, which is the blood of every startup.
Sure.
Right? You've got no funding coming in from the investment side, or little funding coming in from the investment side.
It's just that these guys really created an impact.
Right. But what I'm saying is, from an ecosystem perspective, there's probably a big decrease in overall investment dollars into that space.
Yeah, for a while.
And then at the same time, you have a decrease in ability to generate partnership or revenue dollars from medical institutions or organizations that were particularly gun shy based on some of that past history, IBM, Theranos, etc.
Yeah, it was really, really damaging to the ecosystem of people trying to work in machine learning and artificial intelligence and in healthcare.
Right.
So I think we've finally gotten over that. Now it's 5 or 10 years later. But these were very unfortunate events that could have been avoided.
And so now that we are moving beyond that, what is the state of artificial intelligence and biology today? Where are we?
So, or healthcare, realistically.
Yeah.
So we're at a really amazing pivot point in both. And the past is a bit embarrassing and the future is really exciting. So I've already told you one dirty little secret that's really a dirty big secret about healthcare. Half the journal articles in the New England Journal of Medicine.
Right, we kind of glossed right over that allegation.
Yeah, it's been proven. Yeah. So some papers have been written about this. So it's like, okay, half the stuff that's published is garbage. Now what do you do? And in our medical system today, there's this term called standard of care, which ought to scare the living daylights out of anyone who hears it, because it's not about you surviving your doctor's treatment of you. It's about the doctor not being sued after you die. So it's a legal term. And if your doctor performed according to the standard of care, then he or she will survive the lawsuit, no matter whether you die or not. And unfortunately, as far as I can tell, that is the current thing. When you walk into the hospital, that's the deal. And so whatever's wrong with you.
Wait, hold on. Let me take that back a step. Does that mean when you define standard of care, how is it defined?
Like, what does it sound like?
Well, that's what I'm asking.
It sounds like standard of care. It's what we all do. It's what we all do. We all do it. It's the same thing we all do. So it doesn't guarantee you outcome. Doesn't mean I'm going to save your life. It doesn't mean that it's based on science. It doesn't mean it's based on the best science. It doesn't mean that I'm keeping up with research in the field. It doesn't mean that I'm assuring you as a patient of anything except I'm doing the same thing Bob would do.
So it's based on a past medical practice that has held up in court, essentially, what you're saying.
That's a good way to put it, I think. Yeah. It's a kind of a shield. It's not ill-intended. It's just what everyone hides behind.
Right.
So you got standard of care. Now, the most exciting thing is evidence-based medicine. You may have heard of evidence-based. And when I first heard that term, I thought, wait a minute.
Isn't all medicine
Is it
evidence?
all evidence-based? And the answer is, of course, no. So there's evidence-based. That's a nice idea. It's kind of coming into vogue now.
I would like to be treated with evidence-based medicine.
I would too. I would too. So anyway, that's, that's where we are. That's until today, basically where we are in healthcare. And on AI, it's equally bad, because here's the problem. When someone says AI, it's always neural networks. The people who are really good at neural networks realize there's another dirty little secret, which is a really big secret. AI has three big failure points that are constraints by nature of the AI math, which prevent big things from happening. So you're not going to likely make major, what we call pattern discoveries, using today's neural networks. And when you hear AI, only 99.9% of the time, what people mean is neural networks.
Okay.
So one problem was what's called the black box problem. We've talked about that. So even if you're Google and you have great stuff, you run it, you can get a high prediction rate for what you're doing, but you cannot tell anyone how it did it or why it did it.
Yeah. Right.
And without that information, good luck at making a major discovery. The next thing is what I call the wall. You run it the first time, it's 10% better. You run it the second time, now it's 3% better. Run it the third time, it's 1%. Now it's 0.5%. Now it's half of a 0.5%. You run out of runway here. It's like it's declining returns on investment of time. Right. So that's the wall. Okay. That's not leading you to great invention or discovery either. And then, of course, you have to have a hypothesis. So even if your hypothesis is contained in setting parameters on a Google system, it's still a hypothesis. Mm-hmm. I'm assuming that my hunch is right about these parameters. And by bringing your bias to the game, you almost assure that you won't discover something you didn't expect.
Right. It's kind of like if I were to, I'm just trying to think of a good way to describe this, but what you're doing is saying, here's how we have this existing set of understanding of how things work. And within that set of understanding, we can increase efficiency by up to, 10%, 12% of our existing systems. But there's no way using current neural networks, which have the black box problem, to advance that understanding beyond that efficiency.
That's right. If there were a wholly different signaling system at work in your body, which had 100% impact or 50% impact, you would never
discover it. Right. Yeah.
So therefore, you wouldn't make a major discovery. You tweak it. So that's it. That's kind of where we've come to now.
Now, this podcast isn't intended to be a PR front for Pattern Computer.
No.
So, but it does so happen that, I think you guys have made some pretty exciting discoveries in that space recently, some of which you wrote about in the Global Report this week. And I'm curious if you could talk about what those are, given the fact that, as we've talked about before, Pattern has created a new mathematics that allows it to solve the black box problem in existing neural networks.
Yep.
New ethical explainable AI.
Yep.
And that you are using this pattern computing architecture, which was originally developed on stage at Future in Review as part of the CTO challenge, and which is now a company worth more than $1 billion.
Yep.
Which you run in your spare time.
Right.
When you're not making the podcast.
That's spare time. Yeah. Yeah.
Yeah. That's a joke, by the way.
I know. Yeah.
It takes a lot of time and energy, as you know. But I'm curious. So can you tell us a little bit more about given those advances in computing architecture and artificial intelligence, what are some of the discoveries that you've been able to make through Pattern?
Sure. Yeah, and the system's agnostic, so it can do whatever you ask it to look at it. It'll look at it. Recently, we have announced. Well, here's something I just found out yesterday, Berit. In the year 2022, Pattern Computer has been working on the top 5 cancer killers, as you probably know. And in that world of the top 5 cancer killers, in this calendar year, we have announced on average 5 new, novel, patentable drugs for those cancers per month. Per month. Within that time frame this year, we can also now say, of those, we have announced at least one per month that's passed one or more positive tests to kill that cancer. So, wow.
Wow.
I don't think anyone's ever done that in any world that I know of.
That's
So,
a big deal.
yeah, so there is a qualitative and quantitative difference in the experience of running what we call discovery engines beyond neural networks against these problems without using a hypothesis, break through the black box, and get major discoveries. So we helped another company that does breast cancer detection with tears improve their output or their predictive results by 30 to 40%. That's a gigantic change at a time when people are happy at 3%.
Right.
As you're aware, we now got what looks like the fastest, cheapest, most accurate COVID detection system. That's really important. And that's not an incremental improvement either. So it looks like we can do better than PCR. We do it in 3 seconds for $1 or $2 a test. So it's a really big difference that this kind of system can make.
That's amazing.
Yeah.
I was not aware of the rate of discovery that you'd reached.
Me either. We literally sat down yesterday and started counting. Been too busy head down doing the work, so sit back and start counting, but we did. Yep.
And so when you think about the future of healthcare, what does this entail?
Well, then imagine
where are we going?
Yeah, imagine going beyond what we just discussed, where it's standard of care today. That's scary stuff. You know, that's really frightening. That's medieval to me. So what if you had only data-driven work going on in your hospital? So if someone's going to give you a drug, it's driven by your data. Maybe the system knows your genome, knows what your genetics is. Maybe it knows your past history. Do you have any issues? You know, all the stuff that you get one question about. Maybe you get a survey of your body or of your health system records so that there are 10,000 inputs. Or 39 million inputs, 20,000 genes inputs. So you're getting a very broad array of inputs to personalize to you, and then also about the disease. So if it's cancer, it's not just like today's classifications. It would be, let's get the genome of that cancer. Let's take a look. Let's in real time, let's address that. We know which genes are involved. Let's use the drugs that are best against those genes. Let's fix you, if that's the problem. And so whether you have a common cold or COVID or whatever you got, data driven, not hunch driven, not see me in the morning, take 2 of these kind of thing. You know, who doesn't get that? And so a radical change driven by data, real data, personal data and scientific data combined to help you out.
And so I think I'm curious, like this is all very exciting and it's still in the discovery phase.
Yes.
What do we need to do? Like, what would the industry need to do? What do we as viewers need to do to accelerate this transition?
Well, the viewer part's hard. I would just be more and more aware of the availability of things like this. They'll always cost a little more in the beginning. Not always. Not the COVID thing costs less. So maybe both happen economically. Something will be less, some will be more. But if you have, as a patient, if you have a point of view that you care about science, and you care about being treated with data-driven treatments, by asking questions, you'll do better for yourself or your family than by just assuming that standard of care is okay. And
are there medical institutions, if you are a consumer, that are doing this stuff well?
Not yet, but they're trying. So I won't name any right now, but there are definitely teams that are trying to be really good at this. And the better the tools they get, the better it'll be. I just came up with a phrase that I kind of like that expresses this pretty closely. And it's something that archaeologists would immediately understand. And the phrase is, we'll be known by the tools that we use. They will know us by the tools we use. And so, of course, archaeologists know past human beings that way. These are the Clovis people. They use Clovis tools. How did they make them? They made them with these rocks. So how will we be known in 100 years from the archaeologists then? They'll be doing, crypto archaeology in our computers, but they'll say, oh, they used neural networks. Oh God.
I was going to ask, will pattern computing hold up to generations of weathering and decay?
For at least 10 years. Well, that's why we work on it every day. We have to keep it getting better.
Will the future civilizations be able to find pattern computers within the ruins of our skyscrapers?
I don't know about pattern. I hope so, but the things that we're addressing, the answer would be yes. So when you make a pivot breakthrough in healthcare, or you make a pivot breakthrough in mathematics, or if those two things together help each other, whether they'll remember pattern, I don't know. I hope so, but certainly they will remember the mathematical leaps, and they'll use them, and they'll use things beyond that, and they'll remember the changes in treatments that suddenly did what we just talked about, and they'll remember that, and they'll use that even if they use what's beyond that. Sure of that.
One last thought before we sign off, and one question, which is the thought being, I really think you might want to think about investing in some heavy duty stone tablet inscriptions to maintain the future viability of pattern mathematics.
Yeah.
And the question is this, which is, so let's say I'm not quite sure who our viewers might be, who all of them might be, but if you are running a company or doing work that would benefit from pattern computing, how would someone reach out to Pattern? What's the right avenue? Or
you just go to our website and go right to me, Mark at patterncomputer.com, and the website is full of information so they can learn more.
Okay, great.
Yeah.
And I will add one more plug here, which is if you had been an SNS subscriber already, you would have known this stuff, and you will know more about this topic than we have covered, a lot more than we have covered in this conversation. So if you are not already a member of Strategic News Service, you can do that at stratnews.com. The first month of your membership is free. I encourage everyone to join. We also have a pretty amazing monthly member happy hour that's included in your membership, with experts from around the world in all different spaces. So we just hosted one with Molly Wood, who is the head of the managing director of Jason Calacanis's Climate Fund. We are confirming we'll have another coming up September the 8th, I believe. It's a Thursday, second Thursday in September. So lots of benefits of SNS membership, and including the ability to interact with Mark and I at any given time.
There you go.
So hope that everyone will consider joining.
Thank
Mark,
you.
thank you for your time.
That was fun.
I look forward to our next week's conversation. I never know what they're going to be about.
I know. Nope. Thank you.